Well, we started a new year, and it's really important to establish healthy habits, and that means having a primary care physician. And joining us today from Mercy Health St. Rita's, Dr. Eric Stallkamp, and to talk more about some of the things that are important for us to do. So thanks for joining us, Doctor.
Absolutely. Thank you.
Okay, so it is a new year, and we like to think we should at least go to the doctor once a year, right? So how do we get this schedule and this flow going with a primary care physician?
So first of all, I'll tell you, I remember being a young kid and being at my dentist's office in Delphus, Ohio about 40 years ago, and remember a sign hanging there that said, "An ounce of prevention is worth a pound of cure." That statement is never more true, or has never been more true than it is today. Today in medicine, we have such great screening techniques that really allow us to catch illnesses early and prevent lots of problems. So the way to do it is, quite honestly, you can just simply call the hospital. Certainly, you can call if you have a preferred provider that maybe you've talked to someone about. You can certainly call their office and just say you'd like to establish care with them.
And is it good to have a relationship, keep going to the same person over and over?
It really is. I mean, it's very important. The thing that we really want to do is establish a comfortable relationship. And the best way to do that is to get to know someone. We in primary care are primarily focused on prevention, obviously treatment when necessary. And the way to feel comfortable sharing things that may be an issue is simply to have an established relationship with someone you've known over the years.
Okay, so we talk about prevention. So are there standard tests that someone should get done every year?
There are, and those may include blood tests. Depending on age, things may include also screening for breast cancer with mammograms, screening for colon cancer with colonoscopies. And so there are definitely age-based recommendations that your family physician should certainly be up to date with and be able to help guide you in those.
And I would think if you're comfortable with your physician and stuff, I mean, you could talk more and you're maybe more likely to tell about some of those little things that are happening that you might not want to talk about to someone else.
You got it. There are lots of times that patients, and I'm a patient also, that, we don't necessarily like to talk about because they might be embarrassing. But it's also one of those things where the stronger that relationship is, the more likely you are to mention it. So we can help. I mean, that's really the end goal, is to provide optimal care for patients.
It seems like this year people are thinking more about their health. I want to get healthy, I want to exercise and things like that. So can this be a good New Year's resolution, to get yourself going, get that doctor that you feel comfortable with, and get things moving?
Yes, absolutely. And that's something we would highly encourage. We want to take the momentum that comes with New Year's resolutions and really use that to empower patients to advocate for their own health. And so, yeah, absolutely, with eating better and sleeping better and exercising, we would definitely want people to make appointments with a primary care physician so they can get in and really get working on those things.
You brought up sleeping. I think that's such a good thing, too, that, you can start with, your primary care doctor and to talk about all these things. And then if you need to, you can go to a specialist from there, right?
That's exactly correct. Really, the primary care physician is the gateway physician, such that, they're going to screen, they're going to ask those questions, they're going to make sure that everything's okay. And if there are issues, then yes, we can certainly get you referred to specialists as needed, whether it be sleep with a sleep medicine physician, or, again, for those screening colonoscopies, to a GI doctor, or whatever it may be. Yes, absolutely. The primary care physician is going to be the person to help guide you with that.
All right. So time to understand how important a primary care physician is and to go get checked up once a year. Thanks, Dr. Stallkamp, for joining us today.
Absolutely. Thank you, Holly.
All right, don't go away. Noon Edition continues in a moment.